Lisa Smith always wanted a girl, and when her mother died from Alzheimer's disease, her longing for a mother-daughter relationship only intensified. So as the 40-year-old mother and her husband began trying for their second child, they timed their efforts with instructions from the book, How to Choose the Sex of Your Baby. It didn't work. The couple had another boy. For their third child, Smith searched the internet and found the Midwest Fertility and Sex Selection Center. With a little help from the clinic, Smith gave birth to her daughter Olivia 9 months later. Scientific advances have given parents like the Smiths the option to choose their children's gender, or at least greatly increase their odds. Clinics are popping up all over the United States to serve this growing market. They charge up to $20,000 to fulfill a couple's wish to have a boy or a girl.
Predetermining the sex of your baby. It may sound like something out of science fiction, but it's happening right here and right now.
The new procedures also provide options for parents who carry one of 350 genetic disorders that only affect boys, such as certain types of muscular dystrophy. Girls are affected by fewer genetic disorders because many of these diseases are X-linked. With the new options come thorny questions about where all of this is leading. Scientists and ethicists question the psychological and social implications of allowing parents to choose the gender of their children. With such choices, will a child cease to be regarded as a gift and become more of a product of our desires?
Medical sex selection in human beings. I think that's troubling because it puts parents in the role of really turning children into commodities, to consumer goods. That when we order up a car, we specify the color, the interior, the decor, the tires, and so on. But that's what cars are for. Cars are commodities. They're for the sake of giving pleasure. Children are not for the sake of being commodities, and the risk of going beyond the medical use is that we will recast, I think, the relation of parents to children.
But Michael, who are you to tell me?
Some ethical councils say that techniques making it possible to select the sex of a baby should be used only to avoid serious gender-linked disorders. But is there really a moral difference between choosing a child's gender due to medical reasons and choosing a child's gender based purely on preference? And are there moral differences between the various sex selection options?
For those who are interested, there are currently 3 main options for parents to be: pre-implantation genetic diagnosis, microsort, and Erickson. Pre-implantation genetic diagnosis, or PGD, is the most effective of the gender selection procedures, with success rates bordering on 100%. However, most fertility clinics limit the use of PGD to prevent gender-related diseases rather than for simple sex selection. When PGD was introduced in the late 1980s, it was used to help at-risk couples reduce the risk of passing on serious genetic abnormalities. During PGD, eggs are removed from a woman's uterus and then combined with her partner's sperm outside the body. Doctors then test these fertilized eggs, or embryos, for genetic abnormalities and for gender. After the test, several embryos of the desired gender are inserted into the woman. PGD is still used for this reason, but couples who are willing to pay upwards of $15,000 may now be able to use the procedure solely to test for sex. Due to the expense of in vitro fertilization and the reluctance of most clinics to use it for sex selection, alternatives have become commercially available. Some parents turn to a technique called microsort, which is about 90% effective for girl babies and 74% successful for boys. Microsort is not FDA approved, and there are only a few clinics throughout the United States that offer the procedure. During this procedure, sperm are colored with dye and examined under a microscope. The theory is that girl-producing X sperm are larger and will absorb more dye than the boy-producing Y ones. After the sperm are sorted by sex, the preferred gender is inserted into the woman's uterus directly. Occasionally, couples who use microsort may choose to fertilize eggs outside of the uterus and then insert them as embryos. This procedure is about $3,000 per treatment, a number which can balloon to $12,000 if fertilization occurs outside the womb. Additionally, microsort only accepts married couples who already have at least one child of the opposite gender to the one desired. An easier method of gender selection attempts to separate faster-swimming boy sperm from slower girl ones. Called the Erickson method, its creator attests that success rates are as high as 80%. Other scientists say that the method is no more than 50% effective. To do this, sperm are applied to a gluey layer in a test tube and observed as they swim downwards. After the fastest boy sperm are sorted out, the preferred gender are injected into the woman. The $600 procedure may be worth it for some couples, despite the poor success.
The American Society for Reproductive Medicine has endorsed sex selection procedures that sort sperm before the egg is fertilized, but reject those that test embryos for gender and dispose of the ones that are the unwanted sex. But some argue that even sorting sperm could psychologically damage kids whose parents have preconceived notions of ballet lessons and frilly dresses for girls or toy trucks and football practice for boys. Furthermore, some ethicists believe sex selection could be the hypothetical slippery slope leading to parents eventually demanding to choose other traits of their children. Besides personal implications for families, ethicists worry over other moral dilemmas regarding sex selection, such as the inappropriate and unfair use of limited medical resources, as well as gender imbalances that may
He
occur.
does not please one of the pioneers of the procedure.
I went into science and into medicine to diagnose and treat and hopefully cure disease. And the last time I checked, your gender wasn't a disease.
The natural balance of the sexes can create major problems, but researchers say that the situation is highly unlikely in the United States. Most sex selection centers have reported that couples generally request both genders at an equal ratio. But is that even a request that we should be making in the first place?